Let me just mention that the meeting will be recorded. You will see a message on your screen now. And we have to let you know that this is also going to be disseminated publicly. Some house rules, we keep our microphones muted, and then we can add questions and comments in the chat, and Ilaria will let us know any questions. So this event, which is called Implementing Urban Health Research in Practice, is going to focus today on how urban health research can be translated into practice and on effective methods of implementing healthy cities through different ways of assessing, developing, leading, and engaging. And we are very happy to have with us 5 distinguished speakers who are going to give a presentation on these topics. I will present them separately later on. I'll just say a very brief description of the KBUP project, just to give a framework. The project, which is called Knowledge Alliance for Evidence-Based Urban Practices, is an Erasmus Plus Knowledge Alliances project, which started in 2021 in January and will run until 2023. The project aims at creating an international educational and training method, offering participants the opportunity to engage with professional environments, to learn how research can be the basis for innovative professional practices, but at the same time, what practices and businesses in the field of planning, architecture, and urban design require from academia. So it's essentially building a bridge between research and academia. And this is done through a number of activities which you can follow if you like in our website, kbup.eu. Before I move on to introduce our speakers, I would like to give the floor to Cristalla Callafa, who is today with us, and who is Cyprus WHO Healthy Cities Coordinator, for a brief welcome. Cristalla.
Hello to everyone. As you have already been informed by the organizers, my name is Cristalla Callafa. I am working as an environmental health officer posted in the Ministry of Health, and I'm also the coordinator end of the Cyprus Healthy Cities Network of WHO. Dear members of the KBUP project, which is coordinated by the University of Cyprus, it is in this virtual meeting as a Healthy City coordinator, I have the privilege to address you, and thank you. The network aims to build on the capacity of cities and to assist them with a variety of ways in improving the health and the well-being of their citizens. This is usually achieved through topic-specific working groups. Therefore, it is important to strengthen the knowledge and evidence-based practices on the priorities already set, which are planning and design on place, health, inequities, and well-being. It is very important not only to identify and develop tools and instruments to communicate policies to city politicians, but also to understand the supporting mechanism required to enable successful delivery within communities and cities. I wish everyone to have a fruitful participation in the workshop and discussion. I'm also so happy to virtually meet some of the top experts on the field from all over the world. Please allow me to give my special regards and warmer welcome to Charlotte Marchandise. Of course, it would have been better and more pleasant, though, to have had the chance to meet each other under better circumstances and with physical presence. Thank you. We should be patient for that still.
Thank you very much, Cristalla, for the welcoming. The structure of today's event will be 15 to 20 max minutes presentation by each speaker, and then this will be followed by discussion with the audience. So let me introduce our first speaker. I will introduce each speaker before the presentation. So we are happy to have with us Alvaro Valera Sosa, who is the team manager, research and development in Building Health Lab. Alvaro studied at the Charité Medical University of Berlin, and he got a public health master at that institution with a thesis on walkability for health. Since 2011, he has been an evidence-based design researcher at the Technische Universität Berlin. I hope I pronounced that right. Where he conducted numerous pedestrian evaluation projects in various countries. Since 2018, he has founded and he's managing the BHL Building Health Lab and the development of UrbanCare to help assist city planners in cities such as Berlin, Groningen, and Florence. And he's also a commissioning editor for the Cities and Health Journal and collaborates with the German Architects Declare for Climate and Biodiversity. Alvaro is going to talk about UrbanCare as a practical framework to help pedestrian planners improve urban health. The floor is yours.
Well, thank you, Nadia, for the kind introduction, and hello, everyone. It's very nice to be with you, sharing a few ideas on UrbanCare. I would like to share screen right away. I have a load of slides, and I hope I can be in time to show everything. So I'll start right now. Okay, wait a second. Please let me know if the screen is sharing.
Yes, it's fine.
Okay, I would like to. Okay, there you go. All right. So today I wanted to give you an update on this practical framework, which is basically for pedestrian planners to think about health and prioritize health outcomes when doing retrofits in the city, when realizing retrofits in the city, and basically at the neighborhood level. So this framework has been developing throughout a number of years, at least 3 years, and parts of the framework have been practiced in solving different issues in the cities that Nadia kindly mentioned. One of them is Groningen, where we started with some workshops and executed some concepts which are now being developed and taking place. So why pedestrian planning? Well, I think this is a question that 10 years ago would have taken weeks to explain why pedestrian priority would be so important for urban planning. But thanks to the growing literature in the field of walkability research and so on, we understand much better the transformational changes and benefits that pedestrian planning brings to cities. And well, unfortunately, thanks to the pandemic situation as well, that we understand that streets are a great amount of public space in our cities, and especially in countries of the global south, where it's even more critical, the situation of having access and availability of green space and open spaces. So streets there is super relevant and very important to tackle. So now we know a lot more about the benefits to people, specifically health and well-being, and we're talking about not only physical activity, but also mental well-being, social cohesion, and so on, and all the relationships that build at the street level. Also, how to implement climate resilient, climate adaptive measures, and of course, support biodiversity levels to enhance. All that, of course, related to urban health. And so To explain how the framework is implemented or how it works, I broke it down into 4 very distinctive steps. And it's basically for planners to think visually of the material that we have available in cities to work with when we're conducting a retrofit or a new urban plan. We have past experiences, bad ones, good ones, which can teach us a lot of lessons and have to be available. So the framework, what the intention it has is to have that information visually available, accessible, not only to the planners, but also other stakeholders and city makers that want to contribute in a plan. To have active mobility guidelines easily understood, or at least what is the purpose, the intentions, what are the lines of action for the next years, and to have that readily available to implement in a project. And also understand much better environmental health assessments. We see that in many cases, environmental health assessments could be broken down easier for people to read, to identify with, to see themselves as undergoing maybe the issues which are assessed and also published in this aspect. So the practical framework for planners is in action is to manage a broader participation through this visual thinking interface is for people, citizens basically to participate in the research processes, interact a little bit better or more informed in the different design phases. To also integrate convincing green technologies, and which this means is to discern, to differentiate a little bit better, or to know which are those green tools, green technologies, which do promise a better results and a better impact and health outcomes, and those which are not so, and well, commonly labeled as greenwash products and so it's also for planners to quickly assess what are the tools and the technologies which can really help us, and also based on the findings from a broader participation, a broader participatory research, if you want to call it, and activities, to have all that evidence gathered and accelerate decision making. So that's basically the purpose of the practical framework, and as what it is or useful for planners. So the planning process, I'm going to maybe break the input in 2 parts. Well, I will do that, but I'm not sure if I'll have time to bring a case example to explain better what the planning process steps are. So I will concentrate in this first part. And what that is to basically first create a vision with urban health content, conduct environmental health assessments as a second step, devise planning strategies with urban health goals. And that's very important. I will explain in more detail what these steps are. And the fourth one, participate in and monitor the design decision-making process. So these are 4 steps in a planning process and within the context of pedestrian planning. So to help create the vision is basically, I would like to talk to public health researchers or even students in public health, urban health, and health disciplines that want to engage in planning, that the most practical way of implementing all that public health knowledge, or what is good for and the benefit of people's health, is to participate, to initiate the planning process, to be there in the managing team from the beginning, to maybe join a project which is ongoing, or initiate yours locally in your own neighborhood. Keep in mind that it might take up to 10 years. That's not very encouraging, but that's what in some cases we see. For example, in the municipality of Rotterdam, there's a case where there was from the bottom-up approach, there was a citizens initiative to pedestrianize a street in a very centric neighborhood. And it took from day one all the way to passing 10 years later to have a pedestrianized avenue with, well, mixed uses, mixed travel with bike lanes integrated as well. And the same for Berlin. Also, we've had these experiments that have been on the table for very long, and it takes a very I would say complicated and complex process to get it on wheels and execute. And we know the consequences of having a top-down approach, which is more executive and, of course, a faster way of implementing improvements, but with its consequences. So that would be the first recommendation: join a project and start one, and then review the project's mission. If you're joining one, review what the project's mission is and its goals. Does it enhance ecological services? Does it improve urban services? So what's the nature of that project that you're joining? And screen the project for urban health policy, strategies, and actions. So if the project is looking at these city services, well, are these health conducive environments? Are they're talking about? Are they using the urban health, let's say, lexicon, language? Are they aiming at goals that could intersect with health? And the same for ecological factors impacting health. Is it a project merely for a stormwater management, or does it have also the ultimate goal of improving whatever health aspect? So answering that question, we are very critical into looking at the nature of the project, and we ask ourselves: does it improve a healthy diet? Does it improve social cohesion? Does it tackle hazardous heat spots that affect, that increase heat-related diseases and mortality? So if the answer is no, then it's a fantastic opportunity to integrate health goals to the plan. Conduct environmental health assessments. So now that we know that the project is not health-oriented, so it's time to gather evidence and to find data, information on the key health issues. And for that, we have enormous databases available in most cities, I would say. There's a lot of knowledge that perhaps is fragmented in the knowledge landscape, let's call it that way, universities or even city databases like we have in Berlin. We have the geodata database called FISBroker, which is open access. And also we have agencies like the City Lab Berlin, which encourages research and development and open data access. So we use these tools and complement with field research using mixed methods. So if we don't have the data and the information available, and we see that we need more data, well, let's participate in teams that can go out there and collect the information needed. It could be quantitative, as we do at the Building Health Lab. We go out there, we do walkability assessments with thermal cameras, we take pictures where we know that people take their time in having a little break or before crossing a street, which are vulnerable spots of streets for vulnerable groups, and where heat spots could actually affect their health. And also qualitative research with focus groups and so on. So many different tools and methods to collect information, first-hand information. So once we have the data that we collect and through field research, our recommendation is to model the data and to communicate the results using infographics. So we know that, for example, in pedestrian plans, most of the planners are coming from traffic planning, and the way they see pedestrian environments is as a sidewalk that has to be efficient for the 10-minute walk. So perhaps to compete with that, which is very straightforward, we have to provide infographics, graphs, information, which is visually attractive to communicate the need that other groups are also using that sidewalk, also using those streets, and what is it that we have to improve. Is it seating, for example, as for example, we see here in the left, these are bars which indicate in how many meters, for example, a person with a cane should require free seating, which is not at a bar or restaurant or so on with a terrace, but free seating without paying and in proper conditions. And in contrast, we see a healthy couple or healthy people, which are in 10 minutes, reaching 900, 1,000 meters within 10 minutes. So there we see a comparison of both distance and speed within the usage of sidewalks. So it's very important to communicate this knowledge, and I'm sure that city planners and pedestrian planners will integrate this easily to their plans if understood. Health conducive environments. We talk about healthy destinations, but it's important to communicate, okay, what is a healthy destination? What is the quality of service that it has? How's the access to that destination? Properly assess it and highlight what the problems are in order to have access to these places. Ecological factors which affect also these different locations. Hilaria, please, you're the timekeeping, I guess. Please let me know if I'm taking too long, and I'll speed it up in some slides because there's a few to go. And step number 3, devise planning strategies with urban health goals. So what that means is that once we have the data, we have all the data translated infographically, that people or different city makers are on board and understand what is needed and what the importance of the factors to improve are. So we establish now a dialogue, a transdisciplinary dialogue, to discuss these key health issues that were found, and basically to well, that's me there in a workshop, to basically build what we call building blocks, or to structure building blocks that are the intersect of physical environment improvement with health goals. So that's what the transdisciplinary table is about, that we see, okay, if we're making a specific intervention at a pedestrian crossing, at a large intersection, and so, okay, beyond safety, what other elements can improve health outcomes, or what other vulnerable groups could be integrated in crossing this street properly. So from all this discussion, we can see here, and please follow with there's notes on the left, and these notes are translated into visuals of possible interventions that cure the landscape and also protect the health of people, or that's the intention. So here we're taking notes from a workshop that we did in Groningen, and we're recreating these building blocks for health in a landscape here in Berlin. So it's also translatable, because these are principles that could be applied in other landscapes. So that's an exercise we did just to see how transferable the information is. So the more cases we handle, the more cases that we manage or collaborate, contribute with, of course, we could hone better and improve these building blocks. List.
Alvaro, 4 minutes, yes. Around 4 minutes left.
Okay, thank you. So list the current supportive policies, plans, and actions which are there in the city, and also at the regional level or even the European level in our case, to screen even further these building blocks. Okay, how are they supported? Because if we find that in regulatory policy, technical solutions, and economically these are feasible, of course the decision making accelerates and it's easier to approve them. So we have tools to manage that, to see live the decision making or opinions of as much stakeholders as possible. to approve this. So, and the last step is to participate in and monitor the decision-making process. So that is more about I would say, participatory design, where we have as much stakeholders as possible in an easy way, feeding a model, or the data model that we provide to visualize the landscape where the interventions will be held, and what kind of interventions we will do, and with that, within that model, share what the project's vision is, or even improve it with participation. Know the results of the environmental assessments, and also take a look at the planning strategies that were basically held by specialists in different areas. So I'll quickly go through the different building blocks and where the contribution will be or is actually collected in this kind of matrix, visual matrix that you see there, which we see that, to explain it a little bit better, it's like for spatial inequity, for example, we have 4 action areas where contributors can look at and could state their opinion. And those are visuals to the right, which the users can see. So these were the planning steps. And as I thought, I won't have time to explain the case example, which is basically tools to help implement these 4 steps of the process, and to accelerate these cases in different locations. So you're welcome to please take a look at these cases, or the case that which we have developed further is in Berlin. So we have that link there, and please drop an email, and I'll be happy to get back to you. Thank you very much.
Thank you very much, Alvaro, for a very interesting presentation. I would like now to introduce our next speaker, Ben Cave. Ben is a director of BCA Insight Ltd, and the past president of the International Association for Impact Assessment.
Nadia, sorry, I thought we had Carolyn next, also because I know she needs to leave a little early.
Sorry, okay, my list, sorry, Ben.
Sorry, Ben.
In my list is Ben, okay. So I'll introduce Carolyn then, instead of Ben. So Carolyn is a coordinator of ISGlobal Urban Planning. She's a public health specialist with over 15 years of experience connecting research with implementation to build healthier communities. She has a BA in environmental studies, a master in public health, and a master in psychosocial intervention. She currently coordinates, as I said, the ISGlobal Urban Planning Health and Environment Initiative. And Carolyn is going to talk about translating evidence into practice for urban transformation. So Carolyn, the floor is yours.
Thank you so much. I'm delighted to be here. I'm sorry about the change in order. Thank you for accommodating me. I'm currently at another meeting talking about urban regeneration, where I'm precisely trying to do knowledge translation with other sectors. Can you hear me okay?
Yes, fine.
Great. Okay, so I'm going to share my screen now. Just to say, while I do this, Alvaro, I thought your presentation was fascinating, and just exactly the example of the kind of knowledge into practice that we need. Is my screen being shared now?
Yes.
Yes, so super exciting to see that example. So ISGlobal is a research institute, so we don't do implementation, but we are very interested in how our research can be used in implementation, in monitoring and evaluation, and to generate impact in policy and society. So I'm going to give you an example of how we do that. Before I go into that, though, I just wanted to make sure that we're all kind of sharing the same starting point of what we're talking about, because this is actually one of the fundamental things that I find that I need to do when I go and talk and work with other sectors, is really even understand what we're talking about when we say health. Because when you talk to a lot of people, when you say the word health, they think about being sick or not sick, going to the doctor and the medical system. But really, it's establishing this common language understanding that health is about your complete physical, mental, and social well-being, and not only whether you're sick or not. And so therefore, that gives way for us to understand that most of the drivers that influence our health come from outside of ourselves, right? They come from our environment, our social environment, our work environment, our physical environment. And that's a very important starting point. And so, when we are talking about what is it that we want to achieve, to be very clear that, we think that health is a transversal part of all policies and all actions in the urban sphere. And to establish that, right from the outset, to try and create this shared vision. So that's very important, for what we do. And, to take the roadmap kind of that a lot of the world is using right now, which are the Sustainable Development Goals, and show them that health really is an integral part of all of these. So I think that that's a very important starting point to clarify our, as we say in Spanish, our punto de partida, where we stand. So this is, one of the main messages that I always try and bring when I'm doing the translation, is that the drivers of health in cities come from outside the health sector. Therefore, this is truly a multi-sectoral exercise, and that all these other actors and sectors here, we could also add education, we could add, just about housing and many other departments, or areas and fields, to understand that we are all public health advocates. We all have the potential to be public health actors. And so we need to build that community of practice. So how do we do this? Knowledge translation is one model. And how do we do this at ISGlobal? Well, why are we interested in knowledge translation as a research institute? Because we do believe that, that health evidence can play a major role in rethinking the way we design and live in our cities for improvements. And the links, making these links explicit between researchers and decision-making, can help ensure that policies and interventions are data-driven, and that they include monitoring and evaluation, because unfortunately, monitoring and evaluation is not a standardized part of practice in many disciplines. And, again, in this meeting that I'm in right now, to hear city officials who are in charge of things, of large housing projects, large infrastructure projects, say to me that after 30 years, they realized that decades of investment have not impacted the marginalized communities with which they are working to, and had the mandate to help change, is really, in some ways a very sad thing to hear, that decades of investment they have realized are not getting impact. So why weren't there benchmarks along the way to help raise the flags that the processes were not, and the investments were not achieving the impact that they were designed to do? So that's a key piece. And we believe that there are tools, as you've just heard a little about that Alvaro presented, like health impact assessments and others that can be really vital, but yet they're not integrated into currently a lot of the ways that cities do policy and practice. So there's a lot of opportunities there. And then new methodologies like citizen science can really be empowering for citizens. Like knowledge translation is fundamentally, for me, about clearly stating the need that we all need to work together, but we need to work together in a different way, right? It's not only about what we do, but how we do it. And that we need better collaboration and co-creation of the processes that we use to make the changes that we want to make. So how do we do knowledge translation? This is our model. At one point, there was some recognition by our director that if we wanted to achieve some of the health goals that we did through our research, we would have to go beyond producing high quality research. We would have to enter into capacity building through education and training. We would have to enter into policy and advocacy. So we created these departments to complement our research. And then we created specifically what we call an initiative. And so I am the coordinator of the Urban Planning Environment Initiative, where we help them build on our research base to do knowledge translation, to generate greater impact. So what are our goals, in our initiative? We want to translate the scientific evidence to make it accessible and relevant for many different actors, and I'll show you some examples of that later. We want to create a community of practice among this large sector of other people who need to be involved, and this involves the really critical piece of leaving time and space to create this common language, because we have found that oftentimes we're talking about the same thing using different words, or meaning different words, meaning different things with the same words, right? So what does a health person understand by public space versus an urban planner or a landscape architect? These are very important things that we need to do, is understand what we're talking about. We need to help detect needs. What is needed from these other disciplines in order to integrate health into their practice, right? Understanding the tools and making sure that the tools are developed with them and have ownership by them to make sure that they will be something that doesn't sit on a shelf or is, you know, stored on a desktop, but is something that can be actively used in their practice because it responds to a direct and actual need that they have. And then engage with other stakeholders to ensure uptake of our work. And again, I'll show you how some of the ways that we do that, and then we build capacity to help train people now and then future leaders and practitioners, which is super important. So, you know, one of the things that we try and do here, as you see, is bring our scientific articles into different formats, and our blog is one of those that we do this because, you know, academia is geared around producing scientific articles, and you know, that's great, but most people don't want to read that type of information. It's not in a format that can be readily accessible to them. So, you know, we do blogs, we are active on social media, and we try and give people different ways to understand our evidence. Some of the challenges in doing this work that we found is that research timings, the timing of preparing a proposal, executing our project, and disseminating results is very poorly aligned with policy and political processes, especially when you have quick electoral cycles. There can be differences in responsibilities and competencies that are hard to understand and make working together challenging. For instance, turnover of key staff. You know, you're trying to build trust, you're trying to build a community of practice, and so so that can be challenging. Structural and organizational differences in the way that a government works and academia works, those need to be addressed and can be very difficult to overcome. As I said, the lack of a common language and shared knowledge. And, you know, we find that oftentimes, especially governments can tend to have a reactive versus proactive mentality. That's not always true, and that's changing. I think that the pandemic, for better or for worse, you know, put into manifest a lot of things that need to change. And so there is right now a lot more desire to kind of accelerate transformation and do things. It is a reaction to the pandemic, but it still has a proactive element. So that's exciting to see. And then there's a real lack of value for translation within the research structures. You know, researchers are not asked to give time. It's not valued within the research system because, you know, most researchers are judged on the impact factor of their articles and not the impact that they actually generate in society. And then there's a lack of time and funding for building these partnerships for evaluation. You know, I have yet to find the good funding sources. You know, I'm thrilled that there's the KBUP project, but I think those are few and far between. So there's not an investment in these processes that ultimately can be very rewarding, but do take time and effort and trust. So what have we learned so far in the process? Exactly this, that it takes time to build relationships and trust. It's really essential to develop the shared vision, which is why I showed you those slides at the beginning, like what is my definition of the vision and how we would try and build something like that together. It's great, you know, to have similar ideas and have enthusiasm to work together, but our experience has showed us that you really need to identify a concrete collaboration. It can be something small, but until you actually start working together, it's difficult to really build that community of practice. Change can come from above as well as below. If you have political will and backing, that can be great, but you can also start at the technical and community level. So you can work from both sides. We need to have flexibility and the willing to take risks in what we do. These can be new ways of doing things and doing new things. And, you know, we need to ensure that people have the ability to engage in kind of innovation. Translation might require capacity building. It's not something that just everybody knows how to do or organizations know how to do. And even a little bit of funding can go a long way, but you do usually need some sort of funding. We've also learned that in terms of the content, so that was what we've learned in terms of the process of the way we do things. In terms of the content, you need different formats for different audiences, you know, of your product. So a policymaker could probably need something different, for instance, than school children or youth, or a community activist group. To generate impact, it's very helpful to use storytelling as a method. Graphic design can be very important, and it's definitely worth the investment. And you need consistency and simplicity in the messages. You know, I just repeat a lot of the same things over and over. I get tired of hearing it myself, but it is important. What have we learned so far from these efforts that we've been doing? Well, we have been able to increase our collaborations with local government through these processes. We've also been able to increase our collaborations with private sector and other sectors. The process of translation has allowed us to develop new tools and methodologies, and I'll show you some of those. We've reached new audiences. We've increased our presence in the media. We have had to have a lot more meetings. So Zoom fatigue is something that I'm very aware of, and it's a definite investment of time that has to be recognized within the workplace as valuable. And we've had a diversification in our types of projects and fundings. And contrary, I think, to a lot of the resistance that we had at first, we have increased our publications because what we're doing is meaningful. And at the end of the day, if you put out something that is meaningful, I think people will respond. And the big question is, are we generating increased impact? And that to me is, I think so, I hope so, but how do we measure that? That to me is an unsolved question of how we do that. We can count media hits, for instance. We can count people who've looked at our material, downloaded it, but it's really, I think, still unresolved for me, at least within our own organization, of what are we really achieving with all this translational effort? Do we need to do a policy analysis, but how do we do that when we're working worldwide at various different levels? And I think that this is a really important piece to kind of justify and to continue to garner or generate investment and enthusiasm for what we do. So my conclusions are kind of these, but basically I would say that support for translation it needs to be mainstreamed within our research processes. It's something that should be required, and it helps if institutionally, the people who are the decision makers, the scientific committees, recognize this value, state it explicitly, and build it, just as overheads, for instance, need to be a part of any research proposal. We don't usually let a proposal that doesn't include overheads go through. A research project that doesn't include translational elements, to me, shouldn't be one that the institution, supports in its totality, because this is so important to the work we do. So we need the institutional recognition and mechanisms to bring this forward. So these are, I think, some of the things that it requires to do this work. So now I'm gonna take the time to show you what this might look in practice. Hopefully, I'm gonna see how am I doing on time here. Okay, good. So again, creating simple messages that you repeat, time and time again, helping people understand visually the paradigm shifts that we're talking about. Graphically, can be very helpful. This tells a much more complex story, but it's a very visual way, right? If we're thinking of comparing this to, for instance, a journal article, this can be a good tool that we can use. Keeping messages simple, accompanying them with visuals, and talking about what we're really trying to achieve. As I said, investing, the way that you present evidence, investing in graphic design can be very useful. For instance, this is a conceptual framework that we have, and I won't go into detail, but we've gone through many different iterations of how we can design this graphically so that it's much easier for people to understand and follow along from diverse audiences, right? When this was originally published, it was just kind of a bunch of squares and boxes that had arrows between them. And we found that people really, they couldn't follow along. It wasn't easy for them. And so we've worked to make it more graphically interesting, but this was actually a lot of work, to get this distilled into something that that is more understandable, is not something that just happened from one thing to the next. We went through many iterations. It was hours of work from many different people and then testing it out to make sure people could understand it. This is, again, an example of an infographic, trying to understand how housing influences health. And, I can show this graphic at a wide variety of different types of formats of events and to different audiences. And it's much easier for them to understand, again, than perhaps a traditional scientific article. Here's just an example, to contrast this. Here is this kind of standard way that we would have presented this evidence. It's the results of a paper that's quite important about air pollution. And then, we invested a little bit in the graphic design to make it more impactful. And so this, is one of our more impactful slides that I show, because it talks about children, which people care about. It talks about their ability to learn, and it talks about inequalities, right, in a more visual way. And so it tells that story. Another example of a health impact assessment we did in Barcelona to show how we could, by meeting WHO recommendations, we could prevent premature mortality. And we just tried to make it a little bit more explicit and accessible. In this case, we didn't radically change the format, but through design, we're able to make the information clear, I think. Using maps is also a very powerful way to tell a story. Here we try and show different urban exposures in the city of Barcelona. And, it's very clearly, when you lay it out on a map, you can talk about how this is extremely related to the road network. And so then we can talk about how the mobility model in the city is so impactful on our health because it determines these environmental exposures. They are completely aligned with the traffic network. You know, again, just another example. This was a paper as one of the ones that I was telling you about where the city of Barcelona is undergoing a transformation of an urban model towards the superblock. So we did a health impact assessment of what that would look like to try and show them that changing the urban model was a health impact, a public health intervention. And so we published this paper that was very well received, but in order to communicate this concept to diverse audiences, we need to translate it into a different way. And so this is what we did. And so again, people really love this graphic. We've seen it retweeted, the local government uses it, and it leaves very clearly the idea that the change in urban model is going to accrue health benefits. And this is just mortality. And so even the exact number isn't that important, but it does, I think, make the point that we wanted to make. So the storytelling, you know, graphical images, if we want to talk about high levels of pollution, I can tell you that Barcelona has polluted air and noise pollution issues. But if I show you this image, you know, this is something that might stay with you. Again, if we want to talk about placemaking and urban challenges, you know, of informal settlements, you know, accompanying that story with this visual image is going to be very powerful for people. You know, this tells, again, a story of what it's like to be a pedestrian in most cities where the pedestrian is definitely like in the priority of schemes of space and protection, very, very much less priority than cars. And so what it might feel like for people to be walking around in a city without, you know, better urban planning for a place. And then sometimes humor. This is not my graphic, but you know, I think it can be useful sometimes to use humor to help people understand the points that we want to make. I like that one. And then, you know, as we've grown and had more successes, that's emboldened us to try different new things and invest more. And this is something that we did, which is a comic. It's available online in 3 languages for free. And a comic book that talks about the relationship between public space, between urban model and health. So we summarize a large volume of health evidence in a graphic format that can be accessible. It has links to videos and other multimedia. And it tries to tell the story of what it might be like for families, you know, in urban environments where that are not appropriately planned for health and have exposures which, you know, we would be interested in intervening on. It's important to talk about the problems, but it's also very important to talk about the solutions. People can be very affected if you only tell them how bad everything is without also including the discussion of what we can do about it. So, you know, we always try and include in our work, like here we've laid out the problem, we've studied it, we have some data, but these are the things that we think that we can do to address it. So, you know, again, this is just a slide that we present to illustrate how we think, you know, health needs to be in all policies, how this is something that we're all in together. And we try and, you know, to give concrete examples, Barcelona, the superblock model, the 15-minute city, there, you know, the no car cities. There's a lot of things going on right now that I can think we can use as examples, even though they might not be perfect or applicable everywhere, to show people that there are things that are happening and they can take inspiration from that. And then we want to provide tools for advocacy and action. So that's a huge part of it. We did this ranking, which you can see online, where we categorize 1,000 European cities in terms of air pollution and green space, and you can understand the relationship between mortality and these exposures for a lot of different cities. So you can look up your city, and this is an effective communication tool. For instance, this is just London. And so the ranking, you know, is a scientific study, a modeling exercise that then we translate into this graphic form so that people can use it. And, you know, we get results like this. And, you know, I think that this is something that people will pay attention to if you can present it, you know, and something that can be shown to diverse audiences. But again, it's a tremendous amount of work with the web developer, the scientific team, and the communication department to get to this place. You know, this is one slide, but the work behind it is quite important. And again, this is available online in several different languages. Here's just a list of a number of other tools that are available, you know, making sure that people know that there are things already out there. They don't need to reinvent the wheel to be integrating health into action. And then, when is necessary, we create tools ourselves. So this is an extremely successful example that we've had recently of working with the regional provincial government in Barcelona, where we sat down with the planning department and they said, we want to include health. We know it's important, but we don't know how to get the architects and the planners to really integrate health into planning plazas and parks. Like they need something concrete to help them do it. So it took us 2.5 years, but by this very participatory, careful work, we were able to develop a digital online tool that meets their need. And the ownership of it is completely by them. And now it's based on a scientific literature review that we did. So we accompanied the process. We helped drive it, but really we provide some technical expertise, but they really from the beginning had the ownership in defining how this tool was going to be, the characteristics that it needs and how it should be used. And so, we went through this process and, these are the things that they said that it needed to have, and that they needed to be visual and web-based. You can store, your different project results on there. And they wanted something that could be shared with the community, so that could be used for them to communicate as to why the plazas and parks and public spaces might have certain designs. And so this is just a little bit about the way that it went. We defined the different determinants, health determinants of the public space, and then we categorized them with their different elements. And then once they go through this tool and answer these diverse questions about the public space, they will get a result that can show them where the strengths and weaknesses are in their plan. And they can compare different versions. They can compare before and after to see how their design might be improved. So this tool was just launched 2 weeks ago. It's only available in Catalan, but we hope in the future to translate it into other languages and disseminate it widely, because it really has been one of our more successful collaborations. And so it's great when you have a success, you need to publicize it widely, because everybody likes to hear, about something that's successful. We also do policy briefs for undetermined subjects. And then we try and, make graphics again that can be used, when COVID came out, we really wanted to help make explicit. There was a lot of talk about the virus and its impacts on people, but we really felt that it was important to understand the broader connections between COVID and health and our relationship with the physical environment, and how that needed to be adjusted in order to make sure that people could go outside safely, could access nature safely, and could, have mobility safely, knowing that these are basic needs that, under a very short period of time could be locked down. But for health, we needed to get people to be able to do some of their daily life again. And so how that could be done. And so finally, just to conclude, that I think it's super important when we have these conversations to understand that we can promote health as an effective and efficient entry point for action, right? So there's a lot of discourse now around climate change, around sustainability, zero carbon. These are all concepts that are very hard for people to feel on a personal level, right? The average citizen, the person on the street, sometimes even policymakers. But health is a universal concept that everybody understands. And so when we want to move into action, and we should be moving into action because these are urgent agendas, the demographic changes, the pace of urbanization, problems such as air pollution, which kill millions of people every year, they need addressing in a much more rapid and urgent way. So how can we start taking action? And to absolutely leave clear, for all the reasons that I've said, that health is an excellent entry point to start. It is hard to argue against health, right? And so to leverage that and inspire people that can be done. So that's it. Thank you very much. I don't think I'll be able to stay for the entire rest of the sections of questions and answers, but I will monitor the chat. And so if there's anything I can't respond to immediately, I will try and respond in writing after. Thank you very much.
Thank you very much, Carolyn, for a very interesting presentation, and really addressing the difficulties and the challenges of translating evidence into practice. So now let me welcome Ben Cave. Ben is a director of BCA Insight Ltd and past president of the International Association for Impact Assessment. He specializes in public health, urban planning, and impact assessment, and works globally with civil society, policymakers, public health academics, environment scientists, and spatial planners. His background is in social sciences and public health, and he wants evidence on public health and well-being to inform policy at a strategic level and decisions for individual developments. So Ben is going to present his keynote presentation on putting health in impact assessment, in planning, and in policies for sustainability. Ben.
Thank you very much. Just check, you can hear me all? Am I coming through clearly? Great, okay, good. It's a great honor to be with you today. And I agree with the introduction. It would be much nicer to be meeting in person. I'll be talking about health impact assessment and environmental assessment, as my title slide says there. And while I agree absolutely, completely and wholeheartedly with many of the points made by previous speakers, I'm coming from an impact assessment background, so I'm going to be quite specific about some of the terminology. Also, I really agree, and you know, the way about how you present and make the case for health is fantastically important, and we need to do it across a whole number of different formats, arena, ways in which we make the argument. I think that there's certainly a role for the multimedia presentation, and I'll touch on a bit of that. And in my work, I've used cartoons, theatre, all different ways to use the arts as a way of engaging and engaging with people, finding and kind of swapping ideas and developing understanding. I think I would take issue with one of the last points that Carolyn made about how nobody can argue against health. And I think you know, it is very important to define what we mean, but you know, at the moment, we are finding many people arguing against health. You will find people who are violently opposed to vaccination and to lockdown and to social protection measures, arguing or trying to invoke a public health argument for not going down that route and for keeping societies as open as possible. So I think that we do need to be very careful to see how our messages, or the messages that and the shared understanding that we have about health, is being interpreted and being used, and we need to be alive to the fact that people won't always interpret it the way in which we would like. But this is part of the ongoing dialogue which speakers so far have spoken about. Okay, so impact assessment. This opening slide shows a cityscape. I think it's from Mumbai, and many of the aspects there should have been subject to some form of impact assessment. So it's a very, very important aspect which cuts across many things to do with the built and social environment. And yet, how successful is it? And I think, again, we're talking very much about how we can get policymakers in public sector, in private sector, to engage with arguments about health, about broader sustainability, and about environmental characteristics as well. Okay, slide not moving on. There we go. Okay, so I'm going to start off also with a kind of what's meant to be a hard-hitting message. These next series of slides are from a training program which we were offering, which was for planners and developers, and it's trying to say upfront why you should do this, why it's important. And so straight off, planning and developers can and do make a positive contribution to health and well-being. On the left, we have best case. On the right, we have worst case. So if you just take three variables there on design, actively focusing on health and well-being aspects means that the co-benefits of design can be captured. If you don't pay any attention to that, then health and design, kind of ignoring those, can lead to unintended adverse effects. And by the way, I loved those cartoons Carolyn showed, and the one of the Swedish, the pavement as a cavern, as a kind of safe place in the road as a cavern is very, very strong. Cost and time, benefits to the public sector, certainly in terms of reduced demand on public services. If you work health outcomes into the design, the long-term design, but also on a shorter term, dialogue between planners and regulators, such as public health teams, reduces uncertainty and the risk of late objections. So it means that developments can go through more swiftly. Worst case on the right hand side, design, if the design, and this might be the developer, if they're just trying to minimize cost, drive down cost, then again, they might run into this case where local people object, where local politicians object, where things become much slower and kind of more sticky. Value, and this takes its lead very much from the kind of looking at how improving health adds value to development. So well-being is a positive value to promote. So that's both value in terms of values we might like to aspire to, but also, as it says at the bottom there, commercial benefits, values in terms of euros, dollars, sterling, however. And if you don't pay any attention to that, you're signifying to the world that it's not relevant, well-being is not relevant to development or commercial activity. So just going through some of those quickly. If we think about increased car ownership and use, and here's a quite old picture from, I think, the southwest in England, where you have a, it's not conducive to pedestrians there. I prefer Caroline's cartoon. But all of the things that come from promoting the car, there are many adverse impacts that come from this. Again, this touches on a lot of what Alvaro was talking about. And many of these things have health impacts as well. The best case, for example, a picture here, a home zone in Holland, and this ties in with many of the pictures that Alvaro and Caroline showed as well. Actually, for me, in this one, I think there's still too many cars around the place there, but the pedestrian is prioritized. There's then these points here about on the best case as well. If you're prioritizing active transport at a policy level, you're improving physical activity and social capital, you're decreasing air pollution and carbon dioxide emissions. Also on a kind of individual health level, it's good for mental health, reduces osteoporosis, injuries, etc. And finally, it's a whole lot cheaper as well. So again, this is just another way of showing the same things that Alvaro and Carolyn have showed. Cost and time. If we go through looking at this, again, ignoring the long-term cost of society is not good. That's mainly for the public sector, but it's not great for private sector either. You're kind of minimizing these fees and taking the risk there'll be no objections or other delays. And it's good if you can, if you do work health into the equation. There will, it does take a little bit more time and a little bit more effort and resources from a developer's point of view in the design stage, but you have to balance that with the increased certainty that things will go through. Value. Again, do what we've always done. Carolyn talked about working with the policymakers who've not thought of the links between health and housing and see this right at the end. And again, the kind of implicit signal that's given about how well-being is not part of what we're looking at, and the health of employees, visitors, residents, and surrounding community is not an immediate concern. And I should say also within impact assessment and across the field of impact assessment, this notion of indirect effects and of effects beyond the exact boundary of the development are very important and are getting increasing currency. And these wise thoughts here come from a US organization called Fitwell, who are encouraging developers to sign up, and they have a large and evolving suite of materials and methods and things which the developers need to pay for and they commit to, and their sort of credentials. And this makes the case very strongly that if a developer can show Fitwell accreditation, that there's a strong business case, tenant attraction, so you get longer lease terms of capital value. The health of your employees is improved as well, so also visitors and residents, and then it's good for sort of corporate social responsibility as well. Okay, I just thought I'd put a little bit in here about where I come from, because again, and I think this is important to say, A, I always forget, and B, I think it's important because it shows that in this field, we come from many different disciplines. So my background is in social anthropology and public health, and I have spent most of my working life trying to improve health impact assessment and to improve environmental assessment very much as well. So in the next few minutes for the talk, and just see how much time there is left, I'll talk about impact assessment and transferable skills, public health in the assessment process, and then look at some case studies. So just a minor point also, if we, again, we're talking about how we can actually bring health into the argument and move beyond the kind of, it's great to talk about health, we all agree about health, what do you do? Impact assessment provides a useful way of looking at things, and if we look at the litigation which is in climate change, for an example, impact assessment comes up very, very strongly there. Now we're going to look at some examples where there are formal requirements for health to be considered within impact assessment. So again, we're beginning to tiptoe into the area where we start to alert the lawyers and make the legal case for taking on health and well-being. And this is also of increasing importance to policymakers. So what is impact assessment? Actually, I noted, my ears pricked up, both Alvaro and Carolyn talked about assessment. I think if you're looking at sort of formally defining impact assessment, then it's something which takes part as a policy program. I'm getting confused now. Policy, plan, program, or project. So the different levels there. It's something which takes place as that is being developed, and the idea is that you work with the policymaker and you advise them on the implications of the emerging design. Now, this brings kind of some very interesting tensions there. So we have here a definition from, what is impact assessment. It's both a technical tool for analyzing the consequences, as we see there, of planned interventions. It's also used in unplanned events, natural disasters, war and conflicts, although you might argue whether war and conflict are unplanned, but it can be used there as well. And that's the sort of information gathering and knowledge translation and all of those things which you'd want there. And that draws on a whole range of different information. It's also, on the right, a legal and institutional procedure linked to the decision-making process of a planned intervention. So this is where the lawyers come swooping in. This is where, if an impact assessment is sort of, well, it kind of like holds a mirror up to the policy plan or program or project, and it says these are what the implications will be. Now the policymaker doesn't have to take those into account, but they have to argue very strongly, if they're not taking them into account, why they're ignoring it. So where it's a technical tool, we can use lots of, it draws on academic skills and techniques for gathering information and providing information. And then we begin to shade into something where it has real bite for the policymakers. So there are lots of interesting discussions that go on there, and ethical challenges as well, I think. So in doing impact assessment, we're sort of using many different aspects here. Scientific observation analysis, principles of design, applying regulations and law, and also interpreting local and contextual rights and understandings. So what the views of the affected population are incredibly important. And the point I'll be making is that impact assessment is carried out worldwide, and yet public health is not very well represented within it. So my case is to try and improve that. Okay, so it's an umbrella term. It's applied at all levels of decision making, and in the remaining time, we'll look at health impact assessment and environmental assessment. I'll try and make sure that these slides are available to you, and there are some links here to documents. So this is a best practice paper which is based on a global survey for health impact assessment, and it is subtly different to the work that Carolyn was talking about, because I think that's much more falls in, and I hope she is still around to defend herself, but my understanding there is that is more about an academic exercise, which they'll then do lots of outreach with, but this is for actually working with the policymaker as the policy is being developed. Different definitions for health impact assessment. So again, if we had more time, we could stop to look at the different the similarities and differences across these. There's the different citations there, and I think, I mean, the main thing to make is that it's an evolving definition as we're going through time, and the definition is looking to pick up on current understanding. So environmental assessment, I'll take a little bit of time on this. This is again an umbrella term. It's for both at project level and at strategic level, and this will be familiar to many of you as planners, that you will need to go through these when you're doing a policy or plan or program or project. One of the questions is, can we show us some examples about health in environmental assessment? And this is always a bit of a struggle. There is a report which will hopefully be coming out sometime sort of early next year, which is some work we did with WHO Europe, where we looked at we found 300 examples of EIA and SEA reports that included health across the WHO European region, and then we've wrote up some case studies on the way in which they did that. And a really important thing for this, and it's the most simple thing, again, picks up on what Carolyn and Alvaro were talking about, is how do you define health? And there is a big legal push inspired by the lawyers and the environmental scientists, certainly within environmental assessment, to define health very narrowly, just to define it in terms of its environmental aspects. And so what this report is trying to show is that's not the way practice is done, that in 20% of these cases, we found that health is in one way or another looked at more broadly. And so there mustn't be a presumption that you do take a narrow definition of health. And again, here are some examples at project level of the different things that you can look at. Now, you can argue these will have greater or lesser effects on health, but the point is, in doing this, you work it through and you work out for that particular project, that particular context, what needs to be done about health, and using evidence, using local understanding, and then working that through with the policymaker and getting them to commit to certain actions to both protect and improve health. And so here are some guidance documents. This is for SEA. This is work we did for WHO for UNECE guidance. And this is currently at draft stage because there is being big arguments taking place about how health should be defined. And this is a reference paper we wrote for health in EIA. And it aims to walk the health authority through this very, very complex process. And within that, there are these various diagrams showing the process and the ways in which you can provide input at certain times. So in conclusion, impact assessment is systemic and cross-cutting, and it develops transferable skills in sustainable policymaking across different sectors. It is a dialogue, so this can tilt the balance towards those in power and or with deep pockets. So again, the impact assessor has to be very strong in finding ways in which they can just kind of reach out and engage with local communities. The main thing is, for me, is that it provides a structure that requires policymakers to formally take account of health, and this is a huge opportunity. And yet, as we see, public health is often not fully considered in impact assessment. It tends to be something which is done by through the Ministry of Environment. It's done by environmental scientists. We as public health have I argue strongly that we have a requirement to get involved, and sort of both moral and legal, we could say as well. And then just finally, beware the assumption that a narrow definition of health is required. I think we can all make the case very strongly why that shouldn't be, but I'm alerting you to a whole other group of people who we need to persuade that that is the case. Okay, I'll finish there. Thank you very much.
Thank you very much, Ben. And we continue with our next speaker, Charlotte, Marchandise. Charlotte is an international consultant, currently working at the WHO Academy. She was elected Deputy Mayor for Health in the city of Rennes in 2020, and President of the WHO Healthy Cities French Network. She's chair of the political vision group of European Healthy Cities and the Global Urban Air Pollution Observatory. She is an international expert in health in all policies and urban health approaches. She defends a whole of government and whole of society approach based on community empowerment. And Charlotte will speak about health as a political choice.
Hi everyone. Thank you very much for the invitation. Good to see again people I've met when I was as a policymaker or sometimes as a consultant. I see Parnian from Iran, and that's really amazing that you're still able to connect in between people for urban health, because this is something we absolutely need. By the way, on my capacity as a consultant, I'm working on the urban health capacity building for the WHO Academy. So I'll be happy to talk with you about that so please reach out to me. I'll send my email at the end of my slides, because I think it's really important. The other good thing is that many of the previous speakers have said things I was going to say, so I can be shorter on different things. I also be speaking from a policymaker point of view, from civil society, NGO. I'm not a researcher, and probably it's another way of saying the same things. So yes, health is a political choice. But what is a political choice? Do you train mayors? Do you train policymakers? How are they trained? Are they trained enough, even trained? Or do they know, because they've been elected, they've been nominated, and then they know? How do you put the evidence in their hands? And do they even read the UN paper? Not often, let me tell you that. We had a study when I was as a policymaker. This is my star slide, and how policymakers, decision makers are taking decisions. So that was with health mayors in France, and was a study with the National Public Health School. But from having taken this study in many places, everyone was like, oh yes, we've got to acknowledge that, we've got to see that. So decision making sometimes is on evidence. COVID crisis maybe showed us that it's not all the time. Otherwise, we would have had some common decisions across countries, which we definitely had not. And it was not only about economics, yet of course economical interest and economic power is really important in decision making. Public opinion is huge. Of course, it depends on your country, it depends on your democratic relationship, yet it's something that has to be taken into account. Local competition, and this goes in many countries, often cities, they've got a local competitor, you know, like a city in the same region, in the same country with the same kind of size, and they're like, oh, if this city is doing something, I want to be doing the same thing or do it better. I've got to have a better ranking at the ISGlobal or any other rankings that you may have. Medias are so important. I won cases as deputy mayor when my case was on the media, and the mayor was like, oh, can you do something about it? And before it was on the media, I could not do anything about it. Of course, values, ideas, and political interest. And often I'm telling the people, NGOs or academics that are trying to work with the mayors, read the political program. They've been elected on something. They're like, oh, what? Read the political program? Yeah, please do that. I mean, you can just search for health on it and see what they want, but do that. Social movement, obviously, and personal experience. And I'm not being cynical here. Personal experience is a big part of decision-making because people are not trained. The more you train, the less you rely on your personal experience to make decisions. But if you're not trained, well, that's what you have, right? So I heard mayors saying, oh, my stepsister, she had a breast cancer, so I'm putting everything on Pink October. Okay, so what do? Do you love him? No. You say, oh, okay, very interesting. Do you know that breast cancer has all their determinants and that, for instance, it has a lot of link with inequality? Let's talk about how to go from an event policy to a long-lasting policy that takes into account all of the public health values we've been talking about. So I'd like to meet you to meet Mayor July. She was just elected and she campaigned for better schools, more green spaces, and a safer city. She's human resource. She leads a team in a tech company. She does not speak English, she's French. She never read a research paper. What for? She doesn't know SDGs, but yes, health, yeah, we have a great hospital. Let's put more doctors in the city. And you want to tell her about public health. So you're coming, Almata, Astana, you know, all this complexity and health determinant. Mayor July is not really understanding what you're saying here. And you're telling her science is really, really important. But Mayor July, she was leading during COVID, and you told her so many things, like you've got to wear a mask, not a mask, wash your hand, not wash your hand, drink bleach. What is about science? How do I choose science? And is the vaccine giving you the 5G? And is Bill Gates going to know what you're looking at the TV through the vaccine? She's a mayor, so she's with the people all the time, and the people are telling her the things they're afraid of. She also has a big agenda. She has many things to work on. You're not the priority. She has culture, finance, transportation, housing, security, innovation, procurement, international relationships. She has all that to deal with. And let me tell you something, also often health is not at the top of the agenda. We were hoping that the COVID crisis would at least give us, at least in France, I don't know for other countries, I know a little bit, but that it was going to be all year, you know, at least people were saying, wash your hands. It was amazing. Like, you know, when I was telling wash your hands during my mandate, they were like, oh, come on, yeah, stop it now. But she has many things to think. And this is the policy cycle we always have. If you want to go and talk to a mayor, and Alvaro talk about it too, you've got to see where she is. Is that at the beginning that she's just been elected and you can give her emerging issue, you can influence the agenda setting, and for urban planning is the bet? Or is it the moment you're formulating, that the moment she's adopting a law, a government, is that the moment they are implementing, evaluating, or supporting? And if it's at the end, if she's going to run for re-election in 6 months, it's not the good moment to bring a new project. And maybe it seems obvious for you, but I've seen it so many times. Like, think about it before, so they will listen to you, otherwise say, why are you talking about that? Why are you even talking about that? So how do you reach out to Mayor July? And we had lots of great examples before about infographics and so on. I'd like to remind this model from the International Union for Health Promotion of an effective advocacy. If you don't have the 6 steps, it's really hard. How do you translate the evidence as urgent? How your challenge is relevant to the policies? Sometimes you bring something to the mayor and it's something that it's on national policy or international policy. So please be relevant. Otherwise, mayors cannot do anything. An agenda. Is that something that is going to be in 10 years? It's hard. Sometimes they seek re-election. So you need to say, well, this is what we can accomplish in 4 years. You need partners. Nothing can be done alone. And so if you go several people together, it's always better than just one researcher or one NGO. Then you have different strategy of advocacy, political, medias, technical, communities, inside organization. And then we talked about it, stories. Tell story, tell things that are interesting, tell things that are creative. That's how you reach out to people. And the amazing article in lots of review we've been quoting on the chat are great, but they're not tools for policymaker in general. So how do you put health in all policy? You got to get win-win strategies. So culture and health, finance and health, transportation and health, and etc. We talked about it before. This is health in all policy in theory. So, let's bring everyone around the table and talk about health. Let's do this boundary spanning approach. And I'm quoting Bednarek that gives the new definition and lots of literature on this boundary spanning approach that has this new way of enhancing research relevance for societal challenges and opening policy windows. And all that is great, but it's a theory. This is my practice. This is how I made health in all policy in Rennes. So this was me, my department, and where I was as health. And this is us with my team trying to reach out to all the other people in the city of Rennes in other policies, so like the sport and the solidarity and the innovation. And sometimes it worked, sometimes it didn't work. Sometimes the sport mayor, he didn't want to talk about health. It was just about sport and competition. Okay, I did some other things. Sport was good for the next mandate. In my case, it didn't work. So the theory is great. The practice is really going into lots of meetings. And the leader of health in all policies in South Australia, she said, for the first 6 months, I was paid to drink coffee. Luckily, she loved coffee. But knowing the people, getting there, not making another meeting, but getting to the meeting of the other. So how do you empower Mayor July? With a positive concept. We talked about how the user experience is so important. I mean, if you design something without the user, it doesn't work. But sometimes she doesn't know how to do democracy. Public health has lots of tools for that. We make graphics. This is something we developed at the French Healthy City Network. It's a city map with all the things that are good for health in the city. And you turn the map and you have an example, a very small example of how you can act on health determinant as a mayor. It works very well. Everyone on the WHO Healthy City has it on their door. They love this map, much more than the health determinant map. Also, when you talk about inequalities, when you talk about equities, show the benefits, show the advantages. People talked about it, I won't go into details, but this is the kind of star infographic to talk about inequality and make understand the difference. Data, Alvaro, you showed that. Probably you will use some of your infographic. You need infracommunal data and you need to show what you're going out to reach. With the WHO Health Economic Assessment Tool, we could prove to the mayor of Nantes that she could save 600 lives within 10 years. Well, my God, that's a good argument, you know. I'm saving people's lives. I'm a hero. Of course, networks, peer-to-peer, sometimes it's much better to train a politician with a politician than with a researcher because they don't feel like, oh my God, I'm not understanding anything about what you're saying. I'm not an epidemiologist and I'm lost. So WHO Healthy City, Hi Cristala, is an amazing movement. But I think I owe everything to it. I owe everything to it. The Play Standard tool is one of the examples. You've been given other example. Inspire, show the people great example, gives them, oh my God, this looks so amazing. Sometimes they think that the city is good for bicycle, but they've never actually went into a bicycle friendly city. This is the case of my city. I never won the case for the safe bicycle lane, maybe someday. And I never was able to take the mayor in charge of urban planning and the mayor to Copenhagen or any other cycling city. And I think that makes a huge difference because they didn't go through it. But some other health determinants where really we could progress on that. Healthy urban planning in my city, we worked a lot, and they're still working with Anoué Legal, for instance, and lots of people in health. We made amazing things. These are great examples. I won't go into the details now, but there are lots of things because we publish things. There's something on the CUSH project, the Complex Urban Systems for Sustainability and Health, that's just been published or is about to publish. Maybe Marcus will tell about. And so we really try to align and tell how it changed during the time, how the researcher and the policymaker tried to talk together through different years and a real storytelling and together with the grassroots movements. I'd like to finish with the COVID-19 lesson learned, the risk and opportunity, because what we saw is networks were robust. When the mayors knew each other, they called each other. We had a meeting with WHO Healthy City bi-monthly to exchange on what we do, what can we do, how can we improve that. In France, when we had local partnerships, we could use them. We could really be more equitable in WHO Healthy Cities and in other cities in general, because we were already engaged, we knew the people. And of course, the political leadership, the convening power in the city changed things. But we still need to do things to empower all the mayors to be champions, to have ambassadors. So this is my favorite cartoon. It's from Ben Cave. He knows I'm always quoting him. This is Health Girl. So let's change Mayor July to be the health champion and to be the adventure for health and equity. Thank you very much.
Thank you very much, Charlotte, for the interesting last slide as well. And let's move to our next speaker, Marcus Grant. Marcus is a past deputy director of the WHO Collaborating Center for Healthy Cities in Bristol. He's an urban designer and chartered landscape architect. He worked in consultancy on rural and urban projects for a broad range of clients, specializing in sustainable development and population health through joining a WHO Collaborating Center. He has worked with built environment professionals in many countries to support healthier lives, reduce health inequalities, and support planetary health. He is the lead author of Integrating Health into Urban and Territorial Planning, a source book published by WHO and UN Habitat in 2020. He's also a co-author of Shaping Neighborhoods, a desktop guide for local health and global sustainability, and a fellow of the Faculty of Public Health in the UK. He founded the international journal Cities and Health in 2016, and he's the editor-in-chief. And Marcus will present interventions in research, policy, and practice. Marcus.
Well, thank you, Nadia, for that introduction. I'm sure everyone's sort of had enough presentations now, and my final presentation now. But take a stretch, I think this will, just take a stretch. Make sure you're sitting comfortably. Then I'll begin. And thank you for inviting me. And it's great to be amongst so many sort of colleagues and people I've worked with and people whose work I really hold in very high esteem. In terms of the interventions in research, policy and practice, just to sort of angle it, I mean, I always love Charlotte's presentation about policymakers and, politicians, and particularly mayors, and when they'll listen and how to, what are the entry points into their political lives, really. My work, I focus very much on public health and built environment professionals. And that's the audience, really, of how to get research into the hands of the professionals, the practitioners, not the researchers, the practitioners who build up built environments, or those who are meant to be maybe protecting our health, but don't really understand how the human habitat is often built in an unhealthy way. So that's sort of my angle on that. I'm come at that as an urban designer and landscape architect, but originally trained in ecology and ecological systems. So I quite like, as Ben did, sort of that sort of trajectory of where I've come from and maybe where I'm going. So I'm trying to often put tools or concepts in the hands of people who either shape the environment, our built environments, or should be involved in shaping our built environments. So just moving my slides on, if I can, let me just see what's happening here. Yeah, there we go. And sort of at the back of this, I've got some sort of thoughts, really. You know, have we forgotten how to create human habitats that support population and planetary health? What are the entry points for change in this very complex sort of politico-economic technical systems? And what's the role of research, policy and practice in supporting change? And I'm very much sort of the mind of less what to do and more how to do it. A few times I've been asked to, and I'll show you with my recent WHO and UN Habitat work, produce a guide on what to do. And I just think there's so much out there on what to do, and so many guides in sort of countries and cities, research centres, what to do. And often we forget how to do it. Where are the entry points and how to do it? And I think a lot of the presentations really are talking about that. How do we do it? We know what to do, but we're not doing it, and we haven't been doing it for years. Sort of building on what other people have been saying, or what has been said, and in the great presentation, start with the neighbourhood. I think if you're trying to build a healthy city, in the end, the neighbourhood is sort of where it's at. That's where change happens. That's what people can relate to. They relate to their own neighbourhood. They relate to the city or the country too, but the neighbourhoods is those building blocks. And if we want health as an outcome, it needs to be an input. And that's very much the work I've been doing with the World Health Organization and UN Habitat. I'll say a bit more about that. So health as an input. We can't expect health to be an outcome if we're not involving health professionals or anyone who knows about health in the design of cities. It might be an outcome, it might not. It would be by chance. You need to have health practitioners involved from the beginning and at all stages. Evidence-informed approaches, definitely take the best evidence, and there's evidence being produced all the time, both on the what to do and on how to do it. Look for those entry points, and many of the previous practitioners have talked about them. Charlotte's been talking about the entry points for getting the attention of a mayor, but there's the entry points in the planning system and the very complex cycles of planning that have been talked about before, and building those alliances. It's not, no one can do it on their own, it's building alliances. So the publications I've been involved with more recently is this third edition of Shaping Neighbourhoods, and my original job at the World Health Collaborating Centre when I was employed in 1997 was actually for the first edition of this. So it represents a huge sort of almost 25 years of research and work of that WHO Collaborating Centre, which was the only collaborating centre in the world not in a health faculty, but in a faculty of the built environment. The first edition came out in 2003, and then we had the second edition 2010, and this is the third edition, very much updated in terms of the evidence base and in terms of international examples and much more generic international application. I think the first one was very much about the UK planning system. I've also was involved in the lead author for Integrating Health in Urban and Territorial Planning, the source book, where again I sort of refused to do a what to do guide for UN Habitat and World Health Organization, which they wanted me to do. They said, tell people what to do. I said, no, we've done, you know, that's been done to death. You want to tell people how to do it. And this actually then references 70 other publications or tools, resources that tell people what to do, but it tells people how to use those guides, when to use them, who could be using them, what the entry points are. So it actually links through to all these other things that are out there, some fantastic work that's out there. So this short presentation sort of based on bouncing between those two documents in terms of how they've translated or tried to put evidence in the hands of practitioners. That's just sort of tracking through to how this is tracking through to work that the UN Habitat and World Health Organization have sort of done that's led to this publication. They've also done a lot of joint work together. And if there's any takeaway message from that whole publication, and it's, you know, it's 80 odd pages and all these resources, it's if the purpose of planning is not for human health, human and planetary health, then what is it for? And we're really talking here about sort of doubling down on the building of our habitats, human habitat. It's got to be fit for purpose, and often it's not. And we've gone very much into, well, the what to do. I'll talk about the how to do and the what to do in this third edition of Shaping Neighbourhoods for Local Health and Global Sustainability. So I sort of structure the talk around that, around the chapters in that, but bring in content from both. And it's got 6 chapters in Shaping Neighbourhoods and all these case studies. I did count them before, but I can't remember how many there are, but you can see case studies from all around the world that actually illustrate. Each chapter has 3 or 4 case studies, and they illustrate the points of the chapter. So chapter 1, orientation and principles, and that's a typical sort of page layout, highly sort of illustrated. There's side boxes with mini case studies as well as the major case studies, and tools that are meant to be used then by people. And we've also integrated very much the 17 Sustainable Development Goals, and the sort of black numbers around the edge there are the chapters that refer to them. So some chapters integrate quite a lot of the goals, some of the goals are integrated like climate action across many chapters, and some chapters just like look at one goal. So SDG 17, partnerships and processes, chapter 2 maxes out on that. So orientation and principles, and taking through, I mean, similar to Carolyn, taking people back to first principles, what is health, taking public health practitioners into scales. So built environment practitioners will naturally work at different scales and know that what you might do at a city region scale or a district level is different from a street or a building. But we're trying to spell this out, that those scales are very important, and you've got to know what scale you're at, because the public health practitioners might not quite understand the importance of that. So coming together with that common language that Carolyn talked about in orientation and principles, and that's the just that sort of run of how that chapter runs, the agendas, neighbourhood as a habitat, human habitat, which we dwell on somewhat, the focus on the neighbourhood, why the neighbourhood is so important, and then there's 4 case studies there. Then we go on to the process, and very much taking apart the neighbourhood planning process, both formal processes and the informal and ad hoc processes, of course, bottom-up processes, top-down processes, and looking at in detail the different processes that you might find, stages of the process you might find yourself at, and how health then is an input and an output in these different processes. And looking at public health in these 3 ways: to protect from harm, promote health, and provide services, not just health services, all the services and amenities that people need in their daily lives. And then the outcome, better public health, physical, mental, and health equity. And if you like, the input is that urban and territorial planning there, where the spatial factors that we're looking at, resources, land use, urban form and design, transport and movement networks, and green, blue, public open space. And that's just a sort of a general schema in the big scheme of health improvement and health. That's where healthy neighbourhoods fit in. And of course, you've got hospitals and general practice on the left side there, and we're working more on that right side, supporting vulnerable people, keeping people healthy and improving people's health. And it's amazing the actual percentage there. Now that probably counts, that built environment probably counts to 25% of an individual's health outcomes. But it can also, of course, influence the healthy behaviours, which is 25%, and the socioeconomic factors. It can have an influence on those as well. So it's an enormous amount of health outcomes are through the human habitat, if you like, but often overlooked by sort of traditional health practice. And we look at where health can have an input into the planning process. And this is the simple planning process as broken down by UN Habitat. We do go in more detail in a sort of 7 stage, but we're looking at where health impacts, where health, can have an input there in order to have a health outcome. And then we go into all these, of course, in great detail. I just wanted to sort of a little sideswipe here. So that if we're talking about evidence-based, this is really interesting. And I don't know if many people know about this. So in the UK, NICE, the National Institute for Clinical and Health Excellence, assesses what we can have free, if you like, on the NHS in terms of the cost per quality adjusted life year. So they have a graph, and if something costs, what's it looking like here, less than £35,000, you might have it free on the NHS. It might be a surgical intervention or a new drug. If the costs are around here, it's between that accept and reject. So it's going to be weighed up in other ways. And if the costs are up here, it'll be rejected. So medicines or costs or interventions that are over, where we're there, £55,000 per quality adjusted life year, probably going to be rejected in terms of the National Health Service. Now, they're only weighing up traditional things that you can get, medical and clinical procedures through the National Health Service. So if they were to weigh up in this graph, where would, let's say, a cycleway come, or trees in a park, or lighting a pedestrian footway more? They don't get assessed on this scale, but there is a paper that looked at cycleways in New York, and they come out right down here, £10,000 a quality adjusted life year. So if that was dealt with in the same way that clinical and medical interventions were dealt with, that would be a very good way of spending money in increasing population health. So I think that's a great way of using that evidence base there, evidence base of effectiveness. I'm coming back into that sort of neighborhood planning process, providing for local need, coming back into shaping neighborhoods. So the next chapter, chapter 3, is all about the things that people need to access, this diagram, and how far they might walk or drive if they're across the city to them. And that integrates with the viability of these. You can't have a great swimming pool in your neighborhood. That's a possibly city level or city or large district level amenity, whereas a little toddler's playground might be something you can have at the street corner. So the viability needs to cross-reference with the density of population, the street networks, permeability of the street. It's sort of quite a complex interplay, and we go into a lot of that and the calculations that you might need to do. As I say, this is aimed at built environment professionals, designers, urban designers, planners, etc. And that's that chapter, what it's looking at. Education, community health, recreation, goes through travel, pedestrians, cyclists, public transport, and cars and vans, access to jobs, and a lot of them the local economy, and how to make vibrant town centres. Then chapter 4 moves on to working with natural systems, mainly energy, water, food and soils, water and waste, and how to then start integrating that agenda in to that whole people need agenda as well, with climate and the biodiversity sort of crisis and global extinction also on the agenda. Finally, we come into neighbourhood strategy, which is the bigger strategic planning that needs to be done, introducing these different forms of development, some theoretical, but then going into the case studies and where and how to implement different neighbourhood archetypes and how to make them work for health. And we end up with very much that urban design level. There's the Barcelona super blocks. There's a sort of mini case study there, how to do different densities and different designs going down to almost the building level. And just to, I'm just going to zero in on at the end on 6.13 there, post-occupancy and closing the circle. 6.12 is on tactical change. I don't think I've got a slide about that, but this is what the case study looks like. That's Sweet Home case study in South Africa, looking at participatory planning in an informal settlement. This is Vesterbro in Copenhagen, looking at retrofit of environmental systems. And that's a case study there, just showing you these. They're either 1 or 2 page, the case studies. This is Pont Chevalier in New Zealand, looking at low density intensification, how to make low density work through intensifying the density so that the things become viable, such as bus stops or local shops, cycling to destinations, walking to destinations. Destinations become viable. On that evidence, of course, we don't just want the evidence of the practice, what to do, the evidence, as I say, of process, how to do it. And there's a lot of evidence, what works, how did it work, what made something work. So there's the evidence on process is important. So again, not just the evidence on what to do, but how to do it. And there's the hard skills, the sort of how to design, let's say for cycling, but the soft skills, how, which is sort of what Charlotte's saying, you know, how do we then engage policymakers in that these things are important, the soft skills, the community engagement, the actual advocacy, and there's evidence base around those as well. So sort of to just conclude, really, I come to the end, we put people at the center here. Look at assets, places can be assets, people are assets, the processes themselves, although sometimes they might be broken or corrupt, they can be assets as well to a particular project. The preconditions, the plans, the rules, the finance. When I was assessing, I used to for years assess all the WHO healthy cities across Europe, and the preconditions in some places meant that they could always do really well, have really great results. But we didn't want to then just give the results to the cities where the preconditions were easy. There might be cities in, maybe it was Turkey, maybe in Russia, where the preconditions are really tough. So the outcome isn't so good, but they're doing, they're engaged at a higher level than some of the cities where it's easy. The preconditions make it easy to do this stuff. People at the centre, and that's the diagram that you've probably seen many times. People at the centre, and we involve people in this. It's that diagram isn't some conceptual image for a book. It's a working diagram. It's a health impact assessment living tool that people can work on, and we've worked all around the world with that tool. You could use it for scoping policies, for scoping particular proposals, etc. For scoping the team, are there people missing on the team? And we work very much, well, my work has been very much here in Bristol. This is some of the work in Bristol with communities in Bristol, again using this tool so they can assess their local environments and then bring that to the attention of policymakers, and we've been quite successful with that. So just to finish up, putting the heart back into urban development, spatial health literacy. I just wanted to raise 2 things: spatial health literacy, this post-occupancy evaluation, which also previous speakers have spoken about. We sort of have created all these potentially unhealthy places, but never evaluated them or realized what we were doing. So spatial health literacy, I mean, if you like, built environment professions have great spatial literacy, and public health professions and communities have great health literacy. And what we need to do to put these different tongues together, Carolyn was talking about language, is to build a concept of spatial health literacy across the 2 professions. They're talking in different tongues and inhabit completely different worlds as to what counts as an evidence base. So we need spatial health literacy. The other element of the coda, and there's some material at the end of Shaping Neighbourhoods that talks about this, is actually this post-occupancy evaluation, if you like. There's quite a lot on the post-occupancy evaluation of buildings and research on that, but less on neighbourhoods. But there are some points of contact in the UK, there's a Medical Research Council, have some good guides on evaluating complex interventions and evaluating natural experiments. And if people want to go further into this, there's quite a good resource at the moment, Urban Public Health. Not at the moment, it's something that's been published, the book that's been published, Urban Public Health, a research toolkit for practice and impact. So we really need to come together here, public health and built environment practitioners, to look at what's worked, what doesn't work, and learn, and then feed that back into the design cycle. So just to reiterate, start with the neighborhood. Health needs to be an input if we want it to be an outcome. Otherwise, we're just leaving it to chance. Take the best evidence, look for those entry points, and build alliances for public health and planetary health. And sort of my whole sort of career has been built on trying to juggle with this and put tools and concepts into the hands of designers, if you like. And it's culminated with launching this journal, which some of you might know about, which is meant to be going right into the heart of this, where researchers are publishing in the journal, but we're also doing quite a lot of knowledge translation, so that we can disseminate that research to policymakers. And this is just the front covers from the current special issue, is called Sound and the Healthy City. There's some great work in there, and a special issue that will be coming out, I hope, in 2 or 3 weeks, Asian City Futures, Spatial Form and Health. So we have special issues and also generic issues, and I'd love you all to publish your work in it, to read it, and to help with our knowledge translation aspects of this journal. Yeah, thank you, and let's have a great discussion now. Cheers.
Thank you very much, Marcus. Thank you very much, everyone, for the very insightful and inspiring presentations. I think we can open the floor now for any comments, questions, discussion. And then you can have a quick look through some comments in the chat. So who would like to initiate the discussion? Okay, maybe I'll just start from one of the comments that I saw in the chat. Maybe Ilaria can add to that, to these comments. There was a comment by Kerry that he pointed out that maybe we should also start to look at the ways, or revisit the ways in which we educate future practitioners and professionals. And I think that may relate as well to the term that Marcus mentioned at the end on spatial health literacy. And I think also Charlotte and Carolyn also mentioned in their presentations. So would you like to respond on that in relation to pedagogy and education?
Yeah, I'd like, if it's okay, Nadia, I'd like to reflect on that, especially since 1 year I've been working on the project of the WHO Academy, which is a big project to gather all the capacity building the WHO is doing over the world and have it at the same level for everyone. Because for a moment, sometimes the training was more sending a PowerPoint, and this is not pedagogy. And what we'll try to do now, with the support of the people in the WHO, but also the people from the International Society of Urban Health, and probably UN Habitat, and all of you, is to see what would be the common shared knowledge that we need as the main shared trainings that we need for all professionals. Like what would be the basic capacity building, and then we can improve, and then we know it's not the same to build a city in Medellin or in Paris or in Beijing, but we have things that we all agree on. We have things that we know together. So that's really the reflection on what is that we want everyone to know, and how we do the message so it's universal, and that we speak the same language to a urban planner, to a policymaker, to someone who is building a school, And I'm sure it works. And the more we share example of things that are done and promising practices, but also the conditions that made them possible, and the science of the data and the citizen science is something that we really can achieve, and that would be a game changer. And the second thing is who has the convening power, who can bring around the table the good people. And this is, I mean, I chose not to run again in 2020 as a deputy mayor because I think democracy needs new people all the time. But my God, I regret it so much. It was so great to be deputy mayor because I could convene the people. So this is why I'm really convinced that we need to train mayors, because they are the one that have this real big convening powers that university has less, and I hope like your initiative, KBUP, will have this convening power, because this is where we can get the people in the same room.
Great, thank you, Charlotte. Anyone else from our speakers would like to respond, to reflect on that?
It was sorry, what was the question about education?
Yes.
Yeah, I mean, I'm quite a few years ago, for my work at the WHO Centre, we were drawing together a number of institutions across the world who were putting public health and planners in the same, this is in terms of formal education, professional education, in the same sort of studios or classrooms, and either making sort of joint modules or joint accreditation. And I think there's been, you know, I've noticed over the last 18 months, there's been another upsurge in these courses. There's a number of courses, both I've been involved in a course in Barcelona and one at UCL. And of course, there's the work of Jason Coburn in the States, who've been doing this for quite a while. So there are, I think it's sort of a resurgence of this, of actually trying to hold this together. You know, it's difficult, but basically so the public health professions have to understand that the environment affects people's health, or the built environment, let's say, and equally that architects, planners, transport planners can see that their work has an impact on health, and if they don't know what to do, it can have an adverse impact on health. And you know, so there's been more in that department, I think, happening generally across the world.
Thank you, Marcus. Ben?
I think that education is fantastically important, and it's a long-term goal. Certainly, looking through universities is of getting public health worked through into other sectors and faculties, and that's something we should aspire to do. And a lot of the techniques and tools that we've heard of today are kind of begin to give some of that. You know, they're showing that this is a worthwhile area for research. So I think that's something that, you know, as universities will pick that up more and more. I think what we should also be very aware of is that as that agenda develops, that we can see certain specialities within it, and find a way to support those as well. And I'm speaking from a background of impact assessment, where health in impact assessment has been quite a poor cousin for a long time, and it's not really been looked at in great depth. It's not being picked up by universities. It's not really considered as a core part of the work which public health people do. And yet, as I tried to say, I think it's a huge opportunity that we can work to. And it has this, I think the other thing to look is that we have this cross-cutting agenda, and it's a way of developing these transferable skills. If Mayor Julie is able to understand about these things and begins to take them on and sees how it works and helps her in her work, then it feeds through into many other things as well. So I think I would make a case for A, for the importance of it, and B, for keeping impact assessment in there in one way or another.
Thank you, Ben. And Carolyn, you would like to add? I mean, I've seen the comment that you have just written down on higher education. Carolyn, would you like to add anything?
Let me speak on her behalf, unless maybe she's not able to switch on. So we'll just read out the related comment from Caroline. I also think that we have a huge missed opportunity in the higher education could be more explicitly connected to public administration to engage in the diagnosis, analysis and design, implementation and evaluation of solutions to urban challenges. So she was highlighting how higher education should engage with public administrators, I guess, would involve local authorities and representatives from the decision makers being involved in higher education.
Yeah, and I would add Kerry Farnsworth's comment at the end that there is a very interesting 2-year urbanist training program for all mayors in Denmark, which includes public health and citizen well-being, organized by the Danish Center for Architecture and the Built Environment, which is you know, in line with what we've been discussing. So if we don't have any other comments from our speakers or anybody else, we would move to another question from Mehdi. He is saying that one of the main requirements of sustainable development policies, such as compact and livable cities that are healthy, is changing the insight and perspectives of public domain. How can we change the issues such as American Dream that spreads urban sprawl, development policy throughout the world? Also, after COVID, public is blaming density and crowded streets as a negative aspect of urbanization. How can we planners come up with ideas to change this misunderstanding? So does any of our speakers would like to reflect on Mehdi's question?
I'd like to reflect, but a little bit. I think there will be other reflection after, but these are really, we're really centered in developing country, I feel, in our talk here, because when we're planning things that are I think we're missing equity someplace in here, and how we develop cities depending on where we are. And when we're talking and we put lots of images of northern cities of Holland and Copenhagen and so on, which is something like an ideal for lots of us, an ideal for lots of people amongst us, but it's not an ideal when you're working in other countries, and especially in developing countries where the bicycle is still something for poor people, and the success is having a car. And it's more about how we create another story that's not just the story of the West and the rich countries. And it's the same thing in our cities. I mean, I've been sitting at the National Air Council in France, and you know, they were like, "Oh, we're going to put that many kilometers of bicycle lane." I was like, "Yes, you know, but not everybody knows how to ride a bicycle." And the minister herself said, "Oh, come on, everybody knows how to ride a bicycle." And I think what is really important about public health in urban health is that we take equity into account, and equity around the world and equity within the cities. This is the work of that has been done by the social determinant and Sir Michael Marmot, like showing that the difference of health expectancy within a city can be by 20 years if you take 10 kilometers or 4 kilometers in London. And this is sometimes we must not only see the good example of the north and all these bicycle and all these people happy to bike, and because they are rich people, they are white people, they are mostly male, and we have something we've got to react on equity before showing that. And the French minister just said recently that we've got to stop about the house with a garden. We've got to densify our city to prevent the climate change. She lives in a city in a house with a garden, and she's, you know, but it's not her because she's rich. She can have a garden, and that was really, and this is where we need to have the policymaker also leading by example. Because if the policymaker live in a house with a garden and ride a big car, and they say, "Oh, you other people, you need to change your habits and take a 3-minute shower," it does not work. And I think there's a huge responsibility, which is not only about the building, which is not only about showing and about the story, but really about equity. And I'm really sorry I will have to leave for another meeting, but it was great talking to you all.
Thank you very much, Charlotte. Thank you for your presentation and for being here with us today. We'll be in touch. Any other reflections on Mehdi's question? Yes, Ben?
I have a brief reflection. I think this, well, I'd be interested in hearing from Alvaro and from Marcus on this as well. I think this is a really fascinating question, and many of the things which we would usually point to as the co-benefits for public health and planning are challenged by COVID. So thank you for this question. I think it goes to the issue of scale very much as well, that there are different responses at different scales, that cities and city planners will have a very good understanding of what works at a particular scale, and so are in a good position to take that on. I think that there was, and this is going anecdotal evidence, I'm sure there are figures to back it up, but I think when the weather was good in London, there was an uptake in walking and in cycling when the first lockdown happened, and then the weather has changed, but there's also been a swing back now to many more cars on the road. So I think the link between planning and respiratory pandemics is fantastically important, and I was involved in some work with University of New South Wales for an article looking at this and showing that planning does tend to work very well hand in hand with public health in combating respiratory pandemics, but that this issue of scale is critically important. So again, I think it brings us back to the pedestrian and this notion of a different geographical focus.
Thank you, Ben. Marcus? Yeah.
Yes, just sort of continuing on the COVID and urban planning, urban design theme, urban form. At that very early stage, I can't even remember, 2020, April, with Cities and Health, we put out a call for think pieces, which are all published now, and the sort of collected works are going to come out soon. We're calling it the COVID lockdown papers, and it was about what people were seeing then. It hadn't been researched, but think pieces, things we shouldn't forget and we need to remember and dip back into for urban design. And I've been presenting those at quite a lot of conferences now through the summer, and we've been inviting authors in to talk about them, and one of the powerful rhetorics that I remember around density was one of our authors saying, let's not confuse density and crowding. Crowding has led to more contagion and super spreading. It's not the density at which people live, because you can look at metrics of high dense places like Singapore or Hong Kong, and the actual transmission rates aren't that high. And you can look at areas in America, low density, rural areas, but where everyone's poor people or people with less social means are crowded into workplaces in sheds, packing items for other people, and that's where the transmissions happen. So in low density areas, but they were crowded because they were essential workers, but they weren't working in the sectors that were then protected. They were just sending out sort of bits and pieces to people working in meat packing factories. I think it was meat packing factories, wasn't it, where there was a lot of transmission. So that was crowding, not density. And again, it's one of these things where the difference between crowding and density is understood by people with spatial literacy, but may not be quite understood with people with lower levels of spatial literacy. This is where this spatial health literacy comes in, where people have just picked up something about density and ran with it and come to the wrong conclusions, basically.
Thank you, Marcus. Alvaro?
Yes. Yeah, Marcus, I found very, very interesting this that there has to be some work done in spatial health literacy. And another couple of terms regarding COVID and planning, spatial planning is for example, making the difference between social distancing and virological distancing. So that for planning interventions and so on, and especially for understanding how we can we control these variables at the neighborhood level, which is understanding that, well, what happens at the neighborhood, it could prevent the spread to districts and therefore to the city and so on. So these considerations are really important. In regards to building that spatial health literacy, I find very important that in transdisciplinary workshops to have someone which could break down the language that is being used, some kind of communicational scientist or someone that can track how certain terms are understood across different disciplines. Access for us in architecture is completely different. If I change my cap to public health, what is access in public health? And it's very interesting that we bump into these terms so often, and almost at the end of the session is, oh, that's what you meant. So it's like tracking what's being said and making that effort that everyone is on the same page in terms of language. So these sessions, it could start up. I mean, we had an experience with a professor in communicational processes, and 25 minutes of a warm up really made a difference. So that's regarding that part.
Thank you, Alvaro. I think that was another question that we had, and we were discussing during the KBAP project in relation to urban health, but other issues as well, is exactly language used and common understanding, which is one of the obstacles or difficulties or challenges that we found that we are facing, especially when translating research results and outcomes to non-academics, beyond academia, which I think was discussed quite extensively today by most presentations, with the presentation of infographics, diagrams, and other means of communicating results. But I think that the issue of language is a major one. Yes, Ben?
I agree with that very much. And I think something else that we shouldn't forget is the private sector, who employ vast numbers of people, who will often be involved in developing and bringing forward large developments, is working with them as well to improve their understanding of health and well-being, and how it affects many things. I've we worked on a project for a large power station. I was involved for 7 years. For 5 of those years, it felt like I was pushing on an open door. Each time I talked about health and well-being, they go, yeah, we're interested in that. And I couldn't get support. I couldn't even get pushback. They were just like, oh yeah, all right, fine. And it was right at the very end that we suddenly, all these issues blew up, which I'd been trying to talk to them about. So it's a case, so maybe I wasn't doing my job very well there, but it was trying in many different ways to get the message across of how this is important. So public health certainly is traditionally quite wary, with good reason, of working with the private sector. But planning is much better at doing that and sees the role for private sector there. But I think we need to, that's a big constituent audience to work on.
Marcus?
Yeah, just building on Alvaro and Ben, and particularly around language and the different languages in different, we could call them silos. I mean, I'm with my hat on as the editor-in-chief of Cities and Health. I mean, I see this as a collaborative network, Cities and Health. I'm always looking for good ideas for special issues and collaborations with workshops, and it might be that KBAB want to look at language in future, and we could do some collaboration. I was trained initially in ecology and the natural sciences, and then built environment, and then Hugh Barton said, well, Marcus, go and talk to public health people. And even the term environment, they understand it totally different, because environment, as if you ecology and landscape architecture, it's one thing. Environment to public health is also, it encompasses the social environment and the relationships people have. And, you know, I'm not saying it should or it shouldn't, but you use a word and it's coming, people are hearing it, like Ben said, and saying yes, but they're understanding something totally different. And also the concept of natural environment, because of course, coming from ecology and working in the UK, there's no natural environment. You know, there might be some semi-natural, but there's no natural environment. Everything is either managed or has been tampered with by human. We've cut down forests across Dartmoor, etc. And then suddenly there's people talking about a natural environment. Well, there isn't any, but you've got to use the term as best you can. Or what's the difference between natural and built? I mean, all these things have been hiccups at workshops, in reports, in understanding. Be great to sort of have something where we drill down into some of this and just expose these ridiculous sort of, you know, it's almost like the Tower of Babel, haven't we? We've built these specialisms to such a degree that we can no longer communicate.
So we should do something about that, Marcus. Ben?
Just one final point on this. I think this thing of language is really important. And of course, it goes across language. It's not just across sector, it's across languages as well. We did some training with people from different member states on equity in health impact assessment. And again, we kept coming back, running across this problem of what is equity. And then finally did an exercise for people to translate how they understand equity in their own language. And it was very, very different. You know, we have the formal definitions in English language from Whitehead and I can't remember the other people now, but you know, it's fair, avoidable, et cetera, but actually that translates easily into one word in English. That's not the case in other languages. And I'm sure I'm telling you something which you know far better than I do, but that also is an important thing to pick up on.
Yeah, great. Thank you, Ben. Any other questions? Comments?
Shall I?
Yes.
Make a final question. I don't want to, I'm scared of opening a whole new chapter. I'd like to ask about acceleration, which has been touched upon. But we've mostly focused on translation and implementation and communicating with policymakers. And while on the one hand, I think we've got a lot better at doing all of that in recent years. We are still struggling to some extent, especially convincing policymakers. How do we accelerate given how pressing the issue is? Because we have a climate crisis happening, and a slow pace of change is embedded to a certain extent within the built environment. It does take time to change streets and cities and spaces and housing and retrofitting and so on. So maybe there should be a whole other event about this, but what are your thoughts? What are the best means to start acceleration?
Alvaro?
Well, without taking draconian measures or being a dictator. Well, and in my presentation, I showed a couple of slides of what would be the bottom-up and top-down approach, and that obviously one takes very little time, but the impact is questionable, and the other one, well, it takes forever, but with very, very good results. I think that participation is key, and giving enabling tools. Making well, we do have a lot of information, making it very accessible and including people into the process, which means that I think that the urban development processes have to be very clear. People have to understand how things are done in the city, and starting with university, I've had contact with numerous groups of students in different universities, and sometimes at the university, at the architecture school, at the urban management school, the processes of how to develop a parts of a neighborhood or some whatever urban scene is not very clear. What comes first? Where does the initiative come from? Do I have a part in being part of that initiative team or initiating team or initiator? So I think that the development process has to be very clear, and once that is set, it could be a way of accelerating decision making and implementing.
Thank you, Alvaro. Ben?
So I'm speaking from the point of view of impact assessment, and we traditionally get accused of slowing down the development process and of making it more complicated. In fact, environmental impact assessment was started in the States because of the adverse impacts of unchecked planning. And so it is associated with slowing things down, but I think also it's one of those things of it's taking time to look what the implications might be, so you're not having to kind of mitigate and undo lots of adverse effects. So I think there was a nice distinction which Marcus made between crowding and density. There might also be a distinction to be made between the speed of change and the quality of change. It is fantastically important that we accelerate, but that doesn't mean that we should swing violently from side to side. Also, just to note that there will be societal pushback as well. So, for example, I ride a bike, and my Twitter feed, for some reason I must have ticked something, is full of things about cyclists getting knocked off cars and cyclists arguing with cars and vice versa. There is challenge, and people don't like it when the road is suddenly changed so that it's harder to drive down but easier to walk down. The drivers don't like it. So there is strong pushback, which feeds into this volatile political atmosphere we're in at the moment. So I think we need to be active on all of these levels. Yes, I think it would be certainly good to have more on this. So I would look forward to more events.
I know we're almost out of time. My quick answer, and I was a bit stumped on this acceleration, and I'm pleased to hear other people's answers, but I would look towards very much what happened during COVID and tactical urbanism, doing light ephemeral urban design interventions that you can take away, or they become permanent. So instead of doing things on the drawing board, doing things in situ, with citizens knowing that they can then feed back and say, no, we don't want that, or yeah, we want more of that. So actually, yeah, the city as laboratory, I think that was a term that I'd heard a few years ago. That's a way to do it in the cities, but with the collaboration that people can say, no, we don't want to take it all away again, within parameters, but do the experiments in the cities. Let's see it, how it works. Does it work? Who does it work for? Who doesn't it work for? And then modify it. And then change it. It's sort of like, it's like Ben said, the continual environmental impact assessment or health impact assessment feeding back into the change as it happens in real time.
Alvaro, you wanted to...
Yes, very quickly, I wanted to get back to that because I think it's very important. These pop-up lanes that we have everywhere, especially here in Berlin and so on. But the formalization of these spatial experiments in the city, unfortunately, went wrong, because then they're formalizing some interventions that don't really make sense, but well, it has to do with the post-occupancy but before all that, I'm going to go back to something you said, Marcus, which is, I think it's really important. Did we forget to create or design habitats? So if we would have kind of like already a set of rules to start or to support these pop-up interventions or these spatial experiments, which are, I would say, informed already, that would be a quick start, and then improve on that. Because unfortunately, sometimes they start with the wrong foot.
Okay, thank you.
Thank
I mean,
you.
that opens up another discussion that we could have if we had the time about the role of let's say, what is called urban living labs, or what Marcus essentially referred to, and as a way of breaking these barriers between the different silos and starting from a shared vision, let's say, from the very beginning. But I think that will take us into another discussion. I'll just close the discussion with the last comment, which is on the chat by Shahira, who points out that the rural areas as well need a focus on health. And these areas have become overcrowded lately, especially in developing countries, and that more research is designed and implemented for urban areas. So where do you say this fits in? So let's close with this question. Would anybody like to respond to this question about the need for such approaches in rural areas? Ben?
I'll jump in quickly. I think it's fantastically important, and the relation between urban areas and rural areas and peri-urban areas is fantastically important for urban areas as well, not just for rural areas. So we mustn't forget about that. Lots of our cities depend for food, for all sorts of services on the rural areas. So I think that's a strong point to bring in there, Shahira. There's also kind of issues around if there is development in rural areas, the effect that has on services and on workforce. So rural areas certainly have specific challenges and specific needs, which we would be wise to keep as part of the debate.
Thank you, Ben.
I'm not going to add anything. I think we're sort of out of time, but certainly I would go along with what Ben says about the importance of that, and I think Ben articulated it very well.
Great, thank you very much. So let me thank all our speakers, Ben, Marcus, Alvaro, Charlotte, and Carolyn, who are not here with us, for great presentations, very inspiring, very insightful. I think we started a series of events that I hope we can continue to collaborate and exchange knowledge and best practices. Thank you to everybody who has been here with us. As Ilaria mentioned, there will be a link to this discussion, as well as a link in our resources section in the website of KPAP, which is going to include all the recommendations that we had today on relevant articles, books, and so on. So thank you very much for being with us. Have a nice day.